Why foreign embassies are issuing warning now for the Delhi air pollution.
Right now, Delhi NCR has imposed the strictest anti-pollution curbs under stage 4 of GRAP as air quality slipped into the severe category.
Will GRAP-IV finally be able to address the situation at all? And how New Delhi can address the global alarm bell that is going off with the air pollution crisis? When a foreign mission advises its citizens to stay indoors in India's capital, it signals more than just bad air. It signals a systematic distress. Hello everyone, welcome to Vajiram and Ravi's Flash News. My name is Shubhangi Singh and today we are going to understand that why Singapore foreign mission has issued advisory for its citizens to stay indoors and what is so important about this advisory, why it has become controversial, how Delhi is trying to tackle the air pollution crisis with GRAP-IV, what exactly it is, all of this will be discussed. So let us start with understanding that what exactly has happened. So as of now, the Singapore High Commission in New Delhi has gone ahead and issued a health advisory to the citizens, to the Singaporean citizens, and this has been issued because the air quality in Delhi NCR has turned hazardous. In this advisory, the citizens have been asked to stay indoors, wear masks and monitor air quality so as to ensure that they remain safe. Now, as soon as this was done, especially because of the air quality which was going to severe and hazardous in many areas in Delhi, this has triggered a war of words, and we are not going towards the political war of words, but what kind of image it leaves of India in the global foray. It clearly indicates that there is a international perception which is forming, especially how India manages its urban environmental agenda, urban environmental governance, and especially in its capital. It also raises multiple questions about how public health is managed, how public health is taken seriously or not, what kind of communication governance is going on in India when a foreign mission is stating such an advisory. So in this context, let us try to understand first of all that from where this advisory, what is the core reason of this advisory. As I mentioned, this advisory is very much rooted because of the air quality index which keeps on worsening, because in multiple areas it has been inconsistently between the range of 400 to 500 plus, and when we talk about the categories, it falls in the categories of severe and hazardous to health. Now the major pollutants which are present are particulate matter 2.5, particulate matter 10, then we have nitrous oxides, we also have carbon monoxide and many other which are way beyond the WHO limits which has been established. And Delhi has been looking something like this, where we are seeing dense fog, we are seeing poor visibility, there is extreme disruption in flights and daily mobility. And that's not all, it's not about the disruption, it is about the extreme health impact that the residents of this particular area are going to witness in terms of respiratory issues, eye and throat irritation, the long-term impacts which will come with it, hospital visits which have increased, and high risk that the children and also the healthy adults which are going to bear this. So all in all, when we look at the advisory, it is not coming from a wrong place. This is a public health emergency where all of us should be aware, should be voicing it, and should be looking for its addressal in this situation. Now, when we talk about this worsened situation that lies in front of us, let us move to understanding that what exactly is being done. So in this particular scenario, the main action plan that has been put in place is GRAP, that is Graded Response Action Plan. This GRAP is nothing but a emergency response which has a proper statutory backing, and this framework is activated as the air quality worsens. So this Graded Response Action Plan has 4 stages, and the stages are activated based on the AQI levels, and it is time bound and proper restrictions are placed based on AQI levels. It is implemented by Commission for Air Quality Management, that is CAQM. And when we talk about GRAP, as of now, GRAP stage 4 has been implemented in Delhi. So when as I said, that GRAP is stage based. If the AQI is from 201 to 300, that is when the stage 1 is activated. When it goes beyond 300 to 400, that is when stage 2 is activated, and restrictions are placed based on the stages. For example, if it's stage 1, then the mechanized sweeping starts, then we are looking into enforcing ban, increasing scrutiny over vehicles, then washing roads, all of this begins. If stage 2, then the restrictions get harsher and more. And as of now, we are sitting in stage 4, which is implemented when the AQI goes above 350 to 400. And as of now, we are seeing in multiple monitoring stations that it is reaching even 500. So in this situation, the question is, will the graded response action plan and its ultimate stage 4, will it help? So before we answer that, let us look what is included in GRAP stage 4. So we have vehicular restrictions. That means there is a proper ban on BS3 petrol and BS4 diesel vehicles and their entry. Entry of any non-essential diesel trucks has already been prohibited, and only CNG, electric and essential vehicles are as of now allowed in Delhi NCR area. Other than construction has been banned, and any sort of demolition activities have also been banned. In terms of industry, there has been closure on polluting industrial units, and the red industries have been given ultimatum either to bring in proper monitoring and addressal to the emissions that are coming, or be closed by December 31. Furthermore, there is a proper ban on diesel generators, and there have been restrictions around work, school, where offices have been, especially in terms of offices, up to 50% staff has been asked to work from home, especially for the government offices and private offices where it can work from. Schools, they have been shifted to either online or hybrid mode, and especially younger children, they have been advised to stay indoors. Then the public advisory has been released, and all these measures that have been taken in GRAP-IV, they are a balance between curbing the pollution and saving the people from the ill effects of it. Other than that, certain institutional as well as extra measures have been taken. As of now, CAQM, then we have CPCB and Delhi Pollution Control Committee are the key institutions in this whole scenario, and mechanized road sweeping, water sprinkling, banning of tandoors, crackdown on open burning, monitoring of industrial fuel usage and promotion of cleaner fuels, all of this going on. And tell me in the comment section if any long-term structural changes have been made to address the air pollution apart from the seasonal or just based on AQI level changes that they are taking place. Now, when we have understood that what is the picture that lies for Delhi NCR and how hazy and how smoggy it is as of now, this is when the Singapore advisory came in, and it went on to become extremely controversial because the government was viewing it that they are overstating panic and they are undermining India's capacity to handle their own situation. But in this scenario, this situation does seem to be like out of control, because if we understand, this advisory is asking and highlighting severity of pollution, the public health priorities that are not being taken care of, and lack of trust in local risk management that is being seen. So as of now, this advisory seems to be holding more reality and more ground as to the government view that is coming in regards with this, because the advisory is coming from the place of safety and it highlights multiple bigger issues in front of us, such as why Indian cities are normalizing such an environmental emergency. Because even if you see Delhi NCR, you will find very few people who are wearing masks, who are taking care of the scenario and not going along as if everything is normal. And this also highlights one end, that if citizens are to be adequately warned, and how they should be warned, and why this warning is just for foreign citizens or foreigners who are here. So there are multiple questions that need to be answered, but from the perspective of exam, let us move to an important factor where we will be looking into a global case study that comes from our neighbor, that is China. Because if you remember the time of Beijing Olympics, that was the time China was struggling with extreme air pollution, and within a year China was able to tackle it. What did China do right? How did China reduce the PM 2.5 levels? China went into an extreme addressal of this situation with strict shutdowns of industries, heavier emphasis on clean energy transitions, regional coordination that seems to be lacking as of now in India, and actually long-term enforcement, not every winter fighting with the smog with the AQI levels. So as of now, we get to see that there is a heavy contrast with how India is dealing with the situation and how it can be dealt in long term with stricter reinforcement that work not just for firefighting mode or addressing it for just winters, but to actually not just removing the symptoms but the whole problem itself. What are your thoughts on it? Let me know in the comment section. That was all from my side. Thank you so much.